I'm an infectious disease doctor. This is truly an infectious disease emergency. And there's a limited number of people who are willing to respond in this kind of thing. It's very different for earthquakes or those kind of things. Surgeons are necessary and engineers and so on. But here, what was really needed, first of all, most importantly, was people who were actually willing to go. And there just haven't been that many with this outbreak. So that was, I knew that I could. I knew that I wasn't afraid to go. Even for having me for a mere 2 weeks ended up being pretty important given how incredibly understaffed this hospital was. Certainly in this particular outbreak, what made it a huge challenge was there were many, many Ebola patients and very few people there to take care of them. The nursing staff of this hospital had been decimated by having their own people, their own team, become infected, and many of them had died. We had very few of the old nurses left. And we had a small number of highly experienced nurses, very small number, and several more who were much less experienced and who were not very comfortable coming into the wards and didn't spend much time there. And then we had 3 clinicians and we had 90 patients. Now, perhaps a third of those patients weren't very sick at the time, but a lot of the rest of them could be anywhere from extremely sick to kind of sick, but needing attention. So there was no question that one walked into that ward feeling like there was no possible way to sort of check on everybody and do for everybody what you would like to do. But we did sort of our best to triage who we could get something going on, who was most in need and was most salvageable, which was a very difficult consideration at times. And different clinicians had different feelings about who they needed to spend a lot of time on. Certainly the first day when I walked in and it was just a mass of people and names, and I didn't feel like I could keep track of the patients or anything. But in the next day or so, as we started admitting people, that I was the physician who first saw them and who first got their information. And those become the ones that you start to follow, and some more closely than others. Some become your sort of pet patients, perhaps, and so on. But after a while, you do get to know who is who, and you know them by name, and you realize you know their family members who are in or out or who have died, and so they clearly become much more individuals to you at that point. And some of them you're able to laugh and cheer with as they get better, and some of them, unfortunately, you watch fail and die. With Ebola, we think that probably quite a number of patients who currently die in the West African setting could potentially be saved with better hydration, with a combination of aggressive oral rehydration early in the disease and intravenous hydration later on. Neither of these were we able to deliver in the way that we would like. Getting people to use oral rehydration solution and to orally hydrate does require encouragement and help, and that's true with cholera epidemics, and it's certainly true with Ebola, where people actually kind of feel worse. With Ebola, over time, people become less able to orally hydrate because of weakness, because of trouble swallowing, because of nausea and vomiting, and many of them absolutely require intravenous hydration. Some of them are going to die anyway, even with all the hydration, but there are certainly some that can be saved, that if you can get them through the worst part of it and keep them hydrated, that at least they won't die of dehydration and kidney failure. All crises come to an end. Will this crisis come to an end with Ebola spreading to multiple countries and becoming endemic and being a constant scourge? Or will it end with containment and control and vaccines that work and some therapies that help in treatment? We're waiting to see. There is certainly hope for a number of the vaccines, and that with the help of vaccines and to a lesser extent treatments, that this disease will be contained. But this is still a massive undertaking, and this is going to be a long haul to contain this.